Welcome to CEO Insights. I'm Marilyn de Guzman with Investing News Network. I'm speaking with Doug Page, CEO of Pure Life Healthcare Management, and Doug is providing his insights on the issue of mental health in his company's efforts to address some of the challenges around providing essential care. Hello, Doug.
Hey, Marilyn. Thanks so much for having me today.
Yes, it's very good to have you. Let's start off our conversation with just an overview of Pure Life Healthcare Management and your offerings.
Awesome. Well, thank you again for having me today. Very excited to be here and describe a little bit about the challenges that we're trying to solve. So really, Pure Life Healthcare Management is around trying to, I think, provide complex care management. So we certainly see a significant amount of stress within the healthcare system across Canada and frankly around the world these days. And so really what we're trying to do is come in and provide an integrated healthcare management system where, we provide over 20 different services to individuals that are looking for healthcare support. And so we've got a specialization inside of that, though, with sort of complex care management, specifically around trauma and PTSD. We see significant, increase in that, or certainly an acknowledgement and understanding of mental health issues over the last few years. And we consistently see healthcare systems that are ultimately responding to symptoms and not often dealing with some of the underlying issues. And so what we're trying to do is we're trying to build out a system where we control sort of an ecosystem that provides these 20 plus different services that ultimately clients and individuals can come into our system and spend the majority of their time, really focusing on healing and getting better, as opposed to understanding how to navigate a system, trying to find specialists, trying to find referrals, because every time that we see somebody come into the system, ultimately they're referred to somebody else. And each time they leave one office to go and find another is another time that we see often a lot of people not showing up. And so really we believe by creating a single ecosystem, we not only create very sticky clients, which are beneficial for our shareholders, but also ultimately get much better outcomes for clients, especially when you're looking at some of the complex care when it comes to PTSD and mental health.
So, Doug, in reading sort of some of the information from your company, we see a lot of the mention around wraparound service. Could you just explain to our audience what wraparound service means from your perspective?
Absolutely. So wraparound care services are really meant to be able to provide sort of a full spectrum of support to anybody walking in our door. So you'd be able to walk in and we would both, literally and figuratively wrap our arms and services around you. So you'd be able to walk in and see a doctor, walk down the hallway to see a pharmacist, a massage therapist, a podiatrist, a physiotherapist, any of these services that you might need in order, whether you are trying to heal physically or mentally with that. And so really what we're trying to do is be able to provide that one-stop shop for individuals to be able to come in and get those services that they need. So often what we see across the country is individuals that have to sort of bounce between locations, get referrals, and every time that an individual moves a location, ultimately is an opportunity where they don't show up again at the next location. And so really what we're trying to do is make it as easy as possible for individuals to come into a single location to be able to heal and get the support that they need. Really, we want to take that pressure off of the provincial healthcare systems, the emergency rooms, the walk-in clinics, to be able to provide the supports and really that specialized care, especially when it comes to complex individuals, to be able to provide the supports that they need with.
So I want to talk and get your insights on sort of the current landscape of trauma and mental illness in Canada or in North America. There's some segment of the population that are most at risk for these issues, right? And could you talk a bit more about sort of that landscape and where do you see the gaps are in addressing this issue?
Yeah. Well, I mean, first and foremost, we really view it as a healthcare issue, not an illness issue really with it, right? And so for us, it's about providing the best supports. And part of our difficulty and what I think we want to work on is being able to quantify these things a little bit better. Depending on which sort of study you read, depending on what information you're accessing, depending on, what country you're even looking at, it's difficult to get a perfect picture of what it is. Certainly here in Canada and the US, some of the sort of federal sort of StatsCan models show that about 3.5% of the population at any one time has symptoms consistent with what would be a PTSD diagnosis, a post-traumatic stress disorder diagnosis. About 10% of the population have likely had it at some point in their life, but we don't know for sure. A lot of those numbers are outdated. And often, only in the last few years have we really seen an increase, I think, in an openness and a willingness to start talking about mental health struggles that, quite frankly, everybody has to varying extents. And certainly over the last couple of years, it's been very trying, and a lot of, fractures and gaps in the system exist. And so really what we're trying to do is being able to go out, find those individuals, make sure that they know that there's a place that they can come and get a diagnosis. And so we've got an amazing partnership with a not-for-profit called Heroes Haven that actually provides free PTSD testing, peer support, and actually will help fundraise money to fill in a lot of those funding gaps that might exist for benefits or healthcare models. And so really going out and trying to provide those services that allow individuals to come in and spend a lot of their time focused on healing as opposed to understanding how to navigate the system and get very basic supports.
And I guess one of the challenges, as you mentioned, with mental health or mental health issues, is that it's commonly sort of an invisible disability, right? So it's not it's not physical. You can't see it. So how do you look at solving sort of that gap and that puzzle in making that a little bit more out in the open, more mainstream and being talked about?
Yeah, it's a great question, right? And so I think there's a lot of individuals, companies, media programs that spend a lot of time, I think, trying to normalize mental health. And the fact that all of us deal with our own levels of stress and supports, and all of us have a different level of support and network around us. Some of these folks that have, symptoms consistent with the PTSD diagnosis are often suffering in silence. And so they don't have family supports. They don't have, social supports. They might not have, work. They might be very, very isolated with it. And we see that all the way to sort of the other end of the spectrum, where there's still a significant portion of the population that have all of those things, but still struggle. And so really what we're trying to create is an ability for people to find that support, because we see more and more people being able to talk about mental health challenges. We see days sort of, set aside by different corporations that are trying to sort of, open up the conversation with this. But at the end of the day, often there aren't really many supports that are provided. There might be an 800 number that's sort of given. There might be sort of, reaching out to your family doctor or something else. But as I mentioned, there's so many people in this country that don't even have, a family doctor, or don't have a place to go to understand how to get that help. And so we believe that by providing this wraparound care model, the support where every single service that you might need to get better in healing, all found in one spot, can ultimately really help to solve a lot of those issues.
And your company, with your services, you're targeting a specific segment of the population. Could you talk a bit more about this? Why this market? Why you're targeting this market?
Well, I mentioned a little bit about sort of that 3.5%, and we see that fairly consistent between Canada and the US of the general population. Again, not entirely sure how they're quantifying that, but certainly we see a significant millions of people that exist right now with some form of PTSD that are not able to get support, or at the very least a diagnosis. And so really a lot of the work that we're trying to do is, certainly opening our arms to wrap our arms and supports around any individual that wants to sort us out on that entire spectrum of needs. But really what we're trying to do is target certain industries and individuals that we see significantly higher rates of PTSD, right? So first and foremost, we see veterans, right? Veterans often who have done tours overseas, have had traumatic events that they've been experienced with, really making sure that we're able to work with, Veterans Affairs and different veterans groups to make sure that they're able to tap into our services so that, again, they're not spending time on 1-800 numbers trying to figure out what supports they have. They can come into our system. We can take care of a lot of the work in terms of filling out the paperwork, making sure that we're interacting with government, making sure that they understand everything that they're entitled to with it. We see other industries around first responders, so police officers, emergency EMS and sort of ambulance workers, firefighters, individuals that are regularly encountering traumatic events and not often even having the same level of supports that veterans would have. Coming out of the military, you're often given some basic level of sort of testing and support and oversight with it. But we too often see frontline sort of first responders with very much less support with that. And unfortunately, often having to go on some sort of disability in terms of really trying to be able to get the support that they need and tap into that. We look at other industries, frontline healthcare workers, nurses, doctors, especially coming out of the last couple of years where there's enormous stresses on the system. And ultimately, the very support that they're looking for and the places that gave them or they experienced that trauma in the first place. So being able to create that ecosystem that's outside of maybe a hospital or something else like that. Not to mention, social workers or some of these other folks that are dealing with these very complex care individuals. I mean, we see, rates, again, depending on what study you look at, of 20, 30, upwards of 40% rates of people with symptoms consistent with a PTSD diagnosis. And there's so few resources to help these folks that ultimately they get to a point of having to break or, quit or go on some sort of disability. And really what we're trying to provide is a support system so that they can, find that support, whether it's in terms of taking some sort of short-term leave or coming into our system before they hit a breaking point while they continue to work to be able to gain that support, get stabilized, deal with those underlying mental health issues, physical and mental health issues, and continue on with it, which, is very exciting, but also very daunting in terms of what needs to be built and how we do that.
What's your revenue model? And could you talk about as well sort of your approach in your business strategy for revenue generation?
Yeah, no, that's a great question. So, a lot of certainly the majority of the revenue that we would be coming with is coming from, a combination of the federal government, if you're a veteran, certainly provincial governments here inside of Canada, where every province has a requirement to sort of provide healthcare for citizens with it, as well as certainly healthcare providers and benefits providers, whether that's through, your company or whether you're purchasing sort of benefits over and above that. And so really a lot of our time is spent sort of working with government and helping navigate the system, which unfortunately is some of the challenges that a lot of our clients deal with in terms of some of the bureaucracy and difficulty in finding, simple information. And I think that's something that we can really be able to provide. And, we have a commitment to absolutely be working within, the Canada Health Act. We're not looking at trying to build out a large private network where it's sort of a pay to play. We want to be able to work within that. But really, we believe that creating that single ecosystem where, quite frankly, there's some services that, we do have a profit margin on, whether it be sort of, a cannabis provider, pharmaceuticals, massage therapy, some of these ones that sort of we might be able to direct bill or might be paid by the client, all the ways to sort of into working with doctors to make sure that, as they direct bill the healthcare services that, they have a space to come in and work with. And really, much like our clients, they can spend a lot of their time dealing with the underlying issues as opposed to having to work with administrative issues or background or leases or anything else like that. And so really, we try and work with government to make sure that not only we work within the system that sort of operates, but we have an evaluations model that we're creating so that government can help understand and benefits providers can help understand, certainly the amazing outcomes that we can provide. But our belief is that often we can do it in a much more efficient manner and take pressure off the existing system. So, so that your last resort isn't going to the emergency room, it's coming into our system before you even hit that last resort. And to be able to provide that support and taking that pressure off the emergency rooms, which are challenged at best these days.
So now as we approach sort of go into the end of the year, what does 2024 look like for your company?
Excellent. Well, it's a very busy end of 2023 for us. We've just recently announced one acquisition of a significant virtual clinic based out of Western Canada, but with a national reach. We've got a number of other acquisitions coming up here, both with virtual clinics as well as our first physical wraparound care clinic being acquired with it to finish off 2023. But really 2024 looks to us building out these larger wraparound clinics, right? With our telehealth model and our smaller physical clinics, we're able to provide a portion of these services that we want. And ultimately we can partner with local companies to be able to provide and fill in sort of those gaps. But our goal is to be able to operate these larger physical locations where you're able to walk in the front door and get every single one of those services that you need in order to sort of get better and focus on that mental and physical well-being. And so really 2024 looks at us building out our locations. We're based here in Alberta. And so our expectation is likely we're going to be starting to see each one of those major physical locations being built out here. But really it's building relationships with provincial healthcare providers, because every province delivers healthcare a little bit differently. And so we want to work as a partner in terms of building out a national and soon international network of these facilities that specialize on this physical and mental well-being. And so it's a lot of work to be done, but we're really, really excited, I think, to be able to not only, I think, support the thousands and tens of thousands of clients that we have today and tomorrow, but in 2024, building out that model in a much, much more significant way so that everybody inside of Canada and around the world has access to some of these supports from a wraparound care perspective.
Some really important work you're doing there, absolutely. And thanks, Doug, again for sharing your insights with me today.
Thank you so much for having me and taking the time. I really appreciate it.
And thank you everyone for watching. Join us again next time for another engaging conversation on CEO Insights. If you like this video, make sure you subscribe to our channel and turn on notifications so you don't miss future updates and interviews. See you next time.